Well, good morning, everyone, and g'day to everyone who's watching online, including all of our Facebook followers. It's great to be at the Larapinta Woolworths Distribution Centre today with the Chief Health Officer, Dr. John Gerard, and also Maddie Ryan, who's the Woolworths Queensland Supply Manager. Today I can report 10,391 new positive cases of COVID in Queensland in the last reporting period. Very sadly, that includes another 12 people who have died and were tested positive for COVID near or around their death. And so we think of their families. That's a great loss for them. It's a very sad thing. Of those 12 people who died, a third of them were unvaccinated. And we know in Queensland we're almost at 90% double vaccination, so about 10% of the population is unvaccinated, but they make up today a third of all deaths in Queensland in the last reporting period. And I think that's another reminder to every Queenslander. It's never too late to vaccinate, whether it's your first dose, your second dose, or your booster shot. It's very important to get vaccinated. Yesterday we were reminded by the Chief Health Officer, Dr. John Gerard, that yesterday was the second anniversary of him seeing the first case of what was then a novel coronavirus in Queensland. It was 2 years ago yesterday he saw that first case. And today is another 2-year anniversary. On the 29th of January 2020, Queensland became the first jurisdiction in the country to declare a public health emergency when it came to what was then only known as a novel coronavirus. And on that day, we declared a public health emergency for Queensland, which allowed the Chief Health Officer to enact public health measures to protect the lives and livelihoods of Queenslanders. And I think on any measure, Queensland has done so well during that period. Those measures that we've enacted to protect the lives and livelihoods of Queenslanders have served our state very well. And we were the first jurisdiction to do that, and we've acted decisively at every step during this pandemic to keep Queensland safe. And of course, we now approach the crest of the Omicron wave. And as we approach the crest of the Omicron wave, I don't think we've ever been in a position to be more optimistic about beating this latest challenge of COVID. And that is the challenge we call Omicron. And there's no better place to recognise that than at this distribution centre. When the pandemic started, not many Queenslanders knew about distribution centres. We went to the shops, we bought what we needed, and then we went home. And then came the great toilet paper rush of 2020. And I think that gave us a renewed understanding of what it was to go from manufacture to supply to distribution to the shop shelf. And we had a new appreciation of that. At some points during the recent Omicron wave, there have been up to 40% of staff here who've been unable to work because they've either tested positive or have been a close contact. Every day, every worker who comes to this distribution facility, along with so many other businesses and facilities across Queensland, every worker who comes here does a rapid test. And they do that to keep their workplace safe, to protect their mates, and also to make sure Queenslanders continue to be fed. And today, that isolation rate for workers here has almost halved. And on some days it's gone to a quarter of that. And so that's a great testament to the workers here who are doing everything they can to keep themselves safe and protect their workplace. And it's a great recognition of the processes and procedures companies like Woolworths and so many others around Queensland have done to keep themselves protected. And I want to recognise those companies and businesses who've done so well to protect their workforce, to ensure Queenslanders like me and everyone else can be fed and get the essential goods and supplies they need. And that means now when we go to the shops, we see the shelves starting to fill up again. Queensland has had one of the best responses to COVID in the world. And we've also had one of the best economic recoveries that any jurisdiction's seen. And we want to keep Queensland in that box seat when it comes to job creation, when it comes to business investment and attraction, and when it comes to economic growth. And we're going to continue to do everything we can to move out of this next wave of COVID to ensure we have a strong future for our economy and a strong future for our people. Before I hand over to Dr. Gerard, and Maddie just wants to say a few things too, I just wanted to say something I think that unites all Queenslanders today, and that's a few words about Ash Barty. Tonight, Ash Barty becomes the first Australian woman to appear in an Australian women's single final at the Australian Open for 42 years. Now, regardless of what happens tonight, Ash Barty is a genuine Queensland champion. She is a champion on the court, but she's also a champion off the court. She is a humble Queensland champion, and she started her career. She learnt the craft of tennis just a little way away from where we are today. So on behalf of our state, I want to wish Ash all the very best tonight. She's a wonderful person. She's a terrific role model. And can I conclude by saying this: go Ash, Queensland is behind you every step of the way. I might hand over to Dr. Gerard.
Thank you very much, Treasurer. Sadly, today we have 12 deaths to report. These are 12 people who have died who have had a recently positive COVID-19 test. Of these 12, one was in their 60s, 2 in their 70s, 6 in their 80s, and 3 in their 90s. And again, of the 12, 4 were unvaccinated, 2 had had just a single dose of vaccine, 5 had received 2 doses, and none had received the booster. And we don't have information on one of the 12 about their vaccination status, but our sympathies and thoughts are with their family and friends today. In terms of the hospital situation, we now have a total of 833 people in hospital being treated in Queensland health hospitals for COVID-19. 833 people being treated in Queensland hospitals for COVID-19. That's up slightly from yesterday when we had 818. The number in intensive care is 53, which is down by 1. It was 54 yesterday. We know that the Gold Coast is a solid 7 days ahead of the rest of Queensland, particularly here in the southeast, in terms of its epidemic. So we don't really expect to see significant falls here in the rest of southeast Queensland until sometime in the coming week. And our predictions are accurate in terms of the timing. It's interesting also to see that we're seeing the epidemic occurring in sort of 2 different ways. We're seeing it occurring geographically. So clearly the epidemic started on the Gold Coast between Christmas and New Year, and then spread very rapidly to the rest of Queensland. So geographically it is right across Queensland. But also in terms of age groups. It started in the younger age groups, younger adults, particularly people in their 20s, and then through the younger or the working groups, the workforce of Queensland. And already we're seeing reductions right across Queensland in the numbers of people with COVID-19 in the workforce. We know this from data from health, from the police force, and also here from Woolworths today, that the numbers of people with COVID-19 in the working people at work in Queensland is falling. What we're seeing in hospitals reflects the next group, which is the older age group in particular, and those with comorbidities, and that will be the last group that we will see, and in many ways clearly the most important, because these are the ones that are sickest and the ones that are most likely to experience complications, end up in intensive care, and even some will die. So this is the last group that we will see to be infected. But clearly the epidemic is progressing, and so far the outcomes in terms of hospitalisations and complications is significantly lower than what we were expecting. So we're expecting to see in the next week hopefully further reductions in hospitalisations here in southeast Queensland and then elsewhere in Queensland. Thank you very much indeed.
Good morning everybody and welcome to Brisbane Regional Distribution Centre. It's been an incredibly challenging time for many of us in the community over the last month that we've battled through the Omicron wave. Over the last number of weeks we've seen absenteeism rates in the distribution centre of 30 to 40%. Thankfully this week it's come back to between 10 and 20%, and that's put us in much better shape to deliver products to our stores. We've seen this week so far about a 15% uplift in what we've been getting into our supermarkets. We expect that trend to continue into next week, and it should put us in much better shape. We know everything isn't perfect going into stores at the moment. Meat and toilet paper isn't exactly where we would want it to be, but I think you'll see as you go into shop a number of our key categories are improving day by day, and we should again continue to see that improve into next week. We'd also like to thank our customers in particular who've shown terrific patience going into shop, not getting everything they want in their first visit. So we do really want to thank our customers for the responsible way that they've shopped and the patience that they've shown to us. A big call out to our team members as well, who continue to show up to work every day and tirelessly put in that effort and get those products that we need and love to our stores every day. Finally, I would really like to extend my gratitude and thanks to the Queensland Government in particular. Throughout the last 2 years they've partnered with us, been very pragmatic and collaborative in their approach, and especially over the last month they've really helped us in our close contact controls and protocols, and that's enabled us to have our workforce return quicker and enabled our supply chain to recover. So thank you very much. Sorry? Our rat test supplies are good at the moment. We've got coverage here for a couple of weeks and we get a top up every week. It's really helped us. We've worked closely with the Queensland Government in working through what those protocols are, and having the rat test has given us a level of comfort and security, getting our team members back so we can get those products out to customers. Thank you.
Okay, thanks, Matty. Any questions on COVID? Okay, thank you. All right, any other questions? I might get the Chief Health Officer to answer that. So it's a question about the new variant.
At this stage we're not unduly concerned about the new variant. We're waiting for more information about it. It seems to be a variation on Omicron. As far as we can see, the vaccinations are still effective. And no, it's not at this stage. It's not an undue cause for concern, and we're going to continue to see minor variations like this in the coming months and years. That's to be expected. If I could just remind everybody, and it was one more message that I did want to say at the end before, as we're now moving into that older age group across Queensland, please, it's not too late to get your booster. And can I just remind you that third dose is quite critical, particularly for that age group, as we are moving into that age group, as they are now getting the most affected. So this virus has clearly spread through the younger age groups, and now this is the group that is most at risk of hospitalisation, and that booster is quite critical, and it's extremely effective in protecting you against serious complications of infection. Sure.
I couldn't quite hear when you said before with the numbers of deaths overnight. Were any of those deaths people in aged care facilities? And of those, if that was the case, were they waiting for a booster?
I don't have that. I'm afraid I do not have that specific information. I would tell you if I had it, but I don't have that. I'm sorry.
Right, you mentioned earlier that you're expecting hospitalisation to trend. Is down, correct? So with the cases moving into the old age category.
I think they're in the older age category now, but I think they will slowly trend down in the next week or so. But sorry, if I just emphasise this point, this is the peak. It's not the end. So there will still be people continuing to get this, many people. So we're only sort of like halfway through. It's not the end. So it's not too late to get that booster.
In terms of pressures at hospitals at the moment, we know that family members in particular do an important role in terms of washing clothes, advocating for
Yep.
people. Given like the number of nurses and doctors that are out of the workforce at the moment themselves recovering from COVID, are you getting a plan together to get visitors back into hospital?
Well, we do not stop visitors from going to hospital. We're just limiting the number of people that visit patients at any one time. We made a conscious decision not to stop visitors from going into hospital. So within the wards, two visitors are allowed per patient.
I mean, that's not the case in private hospitals, and I know that that's, out of your control to some extent, but it's certainly not the case at the Wesley, for example. It's a total ban.
I can't speak on behalf of the private hospitals, but we made a very, very conscious decision not to stop visitors to public hospitals because we know what an important role visitors play in the recovery of patients. We limit those visitors to 2 at a time, but we know that visitors play an important role in the recovery of patients in hospitals. No, not at this stage, no. I am aware of that report, and I don't know the details. It certainly will show up on our PCR test, and we can certainly sequence it. And if we had it in Queensland, we have an outstanding system through forensic and scientific services that will detect it very quickly if and when it arrives. I have not heard any reports, unless you've heard otherwise. I've not heard it. No, I've not heard any reports. They report to me every day, or several times a day, and I've not heard anything yet. Okay, so the end of the peak, there are several peaks, in fact. The peak of the young people, the peak of transmission in the community. The one we're most interested in is the peak in hospitalisations. And that's what we're going to see, a steady fall in hospitalisations over a course of 3 or 4 days in the various regions of Queensland. Now, the unknown, and it really is unknown, is what happens as those numbers decline, what the tail looks like. And at this stage, we're still looking interstate and overseas to what actually that looks like. In South Africa, it's dropped right down to baseline. In the UK, it has not. In New South Wales and Victoria, at the moment, they seem to be they're plateauing a bit. It's not totally clear what the next phase is, I'm afraid. So that's what we need to see in the coming days and weeks. But the numbers will decline substantially. We know they will decline substantially during the course of February. We will encourage. Students will be. Well, there'll be a plan will be issued, but masks will be, as I recall, mandatory for. I don't want to get this wrong. Masks will be mandatory for anyone above from year 7 and above, and encouraged for those above year 3. But I'm jumping the gun here because the plan will be released very soon and will be detailed. Sorry, say again. I'm probably jumping the gun on this. I think it's mask mandatory for above year 7, but I think it's encouraged for above year 3. But no, let's wait till the plan is officially released. I probably should not be speaking about that until it's officially released. Go ahead. Yes.
Recognising that it is still being cabinet, but
Yeah.
what was your personal recommendation around an appropriate number of RAT tests for students?
Look, I probably shouldn't talk too much about this plan any further. I think there's a lot of concern about this plan. The plan is pretty common sense. There isn't anything in the plan that will shock Queenslanders. So let me say that in front. So it's going to be pretty common sense. I don't think there's anything that Queenslanders need to worry about. It'll be coming out soon. The details will be coming. I think parents should not be too anxious about this plan. Yes, there will be. We know that. We know that when schools go back, there will be some spike. Now, how much it will impact for hospitalisations, for example, we don't know. But there will be an increase in cases, particularly in young people. But we know that young people generally have a very mild illness, and complications, severe illness, is very uncommon in young people, particularly those under the age of 20. Yep.
So, given that there's a situation where the federal government was managing the vaccination program for aged care facilities, do you think that it's a mistake, especially in retrospect, that families weren't encouraged to take out their loved ones, take them to get their booster independent
Yeah, I don't know the exact circumstances as to why the individuals in residential aged care facilities have not received boosters. I can't really comment on that. I don't know why they would not have received boosters.
Well, it's a failure of the federal government to limit our program.
I don't know the individual circumstances why individuals would not have received a booster by now. It is a little surprising.
Thanks, Dr. Gerard. The original architect of the Integrity Act here in Queensland, in fact, short-term strategic review by an independent panel to look at what...
Sorry, who's that? What's that? What are you quoting from?
The original architect of the Integrity Act. He's called for a short-term independent panel to look at the office of the Integrity Commissioner. Is that something that the government would support?
No, we're considering, obviously, we're going to consider the PCCC report, as the Premier articulated yesterday, and we'll give full consideration to that.
What about the independent panel that doesn't involve politicians looking at the office of the Integrity?
Well, I don't think that's fair to the parliamentary committee either. You know, the 5-year statutory review of the office is now before a parliamentary committee, and I don't know whether Queenslanders are fully aware of that. I haven't seen too much reporting on that, but the reality is there's been a 5-year review conducted by Kevin Yearbury. That's now before the Parliamentary Economics and Governance Committee, and we've seen the work of the PCCC Committee, the Parliamentary Crime and Corruption Committee, which handed down a very serious report. Now, this review is currently before the Parliamentary Committee, and I've got full confidence in the capacity of that committee to properly consider that and make appropriate recommendations. Well, they handed down a very comprehensive bipartisan report. That's the truth. The report of the Parliamentary Crime and Corruption Committee was a bipartisan report. All sides of Parliament agreed, and that's how parliamentary committees often work. So I think it's a very robust process. And can I also add that that's an integrity process, that's an oversight process that a Labor government implemented. The parliamentary committee process, as we know it in Queensland, was implemented by a Labor government. So I've got full confidence in the Economics and Governance Committee to properly consider Kevin Yearbury's report. Yeah, Chris. Look, being lectured to by the LNP on integrity in government is like being lectured to by a drunk on sobriety. It is nonsense. It is just coming from the LNP. It is absolute nonsense that they would have the hide to lecture anyone on integrity in government. They nobbled the PCCC, the Parliamentary Committee, in the middle of the night in Parliament. They jacked up the donations disclosure level in Queensland from $1,000 to $12,000, so you could walk into an LNP minister's office with a brown paper bag full of cash up to $12,000 and it would never have to be reported. And when we reduced it back to $1,000, they opposed it. They opposed the ban on property developer donations, and we know that's a matter that's being considered by the Crime and Corruption Commission at the moment about the LNP taking donations from prohibited property developers and donors in the lead up to the 2020 election. And then we put in all of these other measures, including caps on donations, a new regime for, of course, donations in Queensland, political donations, and of course implementing a new law where conflicts of interest have to be disclosed by ministers, and if not, in certain circumstances, it could be a criminal penalty. So we're not going to be lectured to by the LNP, I can assure you that. Look, that's a matter for... I'm not aware of any of those matters, and that's a matter for Minister Enoch. Look, none of these measures we've had to put in place, and none of the lockdowns and the restrictions that we've had to put on Queenslanders, nobody wanted any of them. No one wanted any of them. But the reality is we had to take steps to keep Queensland safe, and we had to take precautionary steps too. So we had to act promptly and swiftly when we thought there could be an outbreak. Now the reality is that served Queensland very well. We've had very limited lockdowns. We didn't have the 4-month lockdown that we had in New South Wales that frankly paralysed businesses and crushed their economy. So the prompt and swift action, and can I thank Queenslanders again for taking the advice of the Chief Health Officer on acting promptly. On balance, that has been a very good thing for Queensland. I know it's been disruptive, and I accept the difficulties that's caused to families and to businesses, but we've done better than almost any other part of the country, and that's a dividend that's now going back to Queenslanders. I'll come back to yours. Well, look, that's a matter for the criminal justice process. That happens, and I do thank the families who did the right thing when the call went out to them, and I think they've got to be commended for that. Yeah, I think that's a good point. Look, I think anyone who's had a first dose should be getting their second dose as soon as they're available to get it. What we see from the statistics from the Chief Health Officer, it's the second dose, and in particular the third dose or the booster that keeps you protected. And so, yeah, I think the government very much would like to see Queenslanders coming forward. Let's get over that 90% threshold. I think that would be a great thing for our state. It would keep individuals protected, families protected, and the community protected. It would allow a greater effective operation of our economy as well. So I think that's an important threshold, and we're calling on Queenslanders to, as I said before, get your vaccination because it's never too late to vaccinate. Yes. No, I'm never concerned about calling on people to vaccinate. I think it's been vaccination generally has been one of the most important public health measures in history, saving millions and millions of lives. And so COVID's another disease that we can vaccinate against, and that's something we'll always call on people to do, to get vaccinated against all preventable disease, but particularly for COVID. No, I mean, the reality is it's only been a short window since we've been able to get children vaccinated. Again, we don't control the supply of the vaccine. If there are any questions to be asked about why it took till the middle of January to start a vaccination campaign for children, that should be asked of the federal government. But we are distributing those vaccines as quickly as we can get them in Queensland, and I want to thank all of those parents who are looking after their children. That's a very important measure, and I thank them for that. Well, these environmental pledges that Scott Morrison's made, look, it's not about the reef, it's not even about Queensland, it's about seats in Victoria. And we saw that today. The federal coalition is pouring $1 million into two safe seats, Higgins and the federal treasurer's seat of Kooyong, to try and save them. So this isn't about saving the reef, it's about saving seats for the coalition. And I think it's really instructive that Scott Morrison flew to Cairns, but then he flew past all of the climate change deniers and all the climate change sceptics, including George Christensen and Matt Canavan, and their newest candidate in Queensland, Colin Boyce, who's the LNP candidate for Flynn, who is on record as denying climate change. So his parliamentary party is chock full of climate change deniers. I don't believe it. Because, frankly, I don't believe much of what Scott Morrison says, and I'm not alone. I'm not Robinson Crusoe there with most Australians. The reality is it's not about Queensland, it's not about the reef, it's about saving seats for the federal coalition. Well, I think we need to prepare for the future. Obviously, we're going to have more of those charges. You can't park across a driveway at a petrol station or another fueling station, and so it's just similar to that. Yes, Dr. Gerard.
We're hearing every day of people dying who've only had that one dose. Is there a large cohort of people who got their single dose months ago but never came forward for that second dose?
There is a cohort. There's a cohort of young people who've received a single dose who probably have had COVID recently. This group, I'm not aware of a particular. If you're talking about an older age group who only had a single dose, no, not that I'm aware of. They'd probably be selected that they've decided very late. A relatively small group, I'm assuming, that have decided very late to get their first dose. The older people. So there is a larger group of young people who got a first dose recently who have not had a second dose, and that's probably because they've had COVID. But this group you're talking about who have died, who've only had one dose.
Would that be a reason for the lull in getting that 90% double dose rate with that younger
Oh,
cohort?
that's possible. That's very much what our statisticians believe, that there was quite a significant number of young people who got a first dose and then probably got COVID after that, and then have just been slow to get their second dose. That's probably the reason why the second doses have slowed down a bit. Yes, sure.
Lots of people who are double vaccinated who were about due for their booster and then got COVID. Do you get your booster straight away? Do you wait? What's the go?
Well, you can look online about this. There are some guidelines. There is no reason to delay getting a booster if you've had COVID, as long as your symptoms have resolved. That's essentially what the Commonwealth guidelines recommend.